Hi, I'm Jessica Thomas, Director of Patient Education at the Neuroendocrine Tumor Research Foundation, and I'm also a licensed clinical social worker. For today, we're going to talk about caregiving and thrivership. Caregiver burnout is something that is very real, and it's important to talk about, or it becomes the elephant in the room. So we're going to talk a little bit about caregiver burnout, and then we're going to talk about some self-care strategies and tips for caregivers. So to identify caregiver burnout, this is important. So common signs might include emotional exhaustion. This might be feeling drained or helpless or feeling that you're not able to cope with your stressors. Physical fatigue, experiencing tiredness and maybe even physical aches. Mental fatigue, difficulty concentrating, forgetfulness, or feeling detached or disconnected. Changes in your mood, increased irritability, anxiety, or depression. Social withdrawal, pulling away from friends, families, or social activities, things that you liked before. Or even health problems, because with the increased risk of illness due to prolonged stress, poor sleep and unhealthy coping mechanisms can occur. So it's important to address caregiver self-care, both for the caregiver and for the patient. And we're going to talk about a couple of strategies to help you to prevent or manage burnout. The first one is seeking support. So building a support network, leaning on your family, your friends, or support groups can really help you to reduce some of the emotional and physical burden. Don't be afraid to ask for help. Joining a caregiver or support group. When you're able to share experiences with other people who understand what you're going through, this can provide emotional relief and practical advice. And then accessing professional resources. Social workers, therapists, or counselors specializing in caregiving and oncology can offer emotional support and stress management tools. Also, as a caregiver, it's important to set boundaries, recognizing your limits, being realistic of what you can handle. It's okay to say no to things and set boundaries to around your time and energy. Delegating tasks. This means maybe involving other family members or hiring professional help when you can to share some of the caregiving duties such as meal prep, transportation, or medical care. Practicing self-care, one of the most important things. Prioritizing your health. Ensure that you're getting enough sleep, eating a balanced diet, and exercising regularly. Because your well-being directly impacts your ability to care for others too. Take regular breaks. Give yourself time to recharge. Even short moments of rest can help to prevent fatigue from accumulating and getting worse. Engage in hobbies. Doing things that bring you joy and relaxation to maintain your sense of identity outside of caregiving. Managing stress, because we know stress can be a big part of the caregiving role. Practicing mindfulness and relaxation techniques. When you do this, it can help to manage stress and prevent overwhelm. Journaling, writing about your feelings and experiences can help you to process through your emotions and reduce stress. And considering therapy or counseling. There's nothing wrong with this at all. Talking to a mental health professional can help you cope with the emotional toll of caregiving. There's some other tools like staying organized, preparing in advance, considering respite care, taking time off. And you may or may not be in a situation where you need professional care, but if you do, considering a professional respite caretaker where you can temporarily take a break from duties, giving yourself time to rest and recover. And then looking for what's available in your resources in your community. It's important to know what resources are available so you know what to access. It may be support groups, it may be caregiver training programs, it may be counseling for family caregivers. Preventing burnout really does require for you to make yourself a priority. And it's hard, I know, to do. I want to take a moment and say thank you to all caregivers who are caring for, loving, and care about somebody living with neuroendocrine cancer. I hope in this month's Thrivership series, if you are a loved one, you can that is living with a NET or a NEC, share this with somebody who loves you, that's helping you out, and who takes care of you. And if you are a caregiver, thank you so much for all that you do. If you need any resources, my information is here on the screen, and I am more than helpful to connect with you to help you build a self-care plan for caring for you as a caregiver, care partner, or spouse, etc. I'll see you next time.